webinar, How to Own Your Plan of Care, is brought to you by Responsum for CKD, an online community of over 10,000 patients, caregivers, and healthcare professionals in partnership with Otsuka Pharmaceutical. We've got three awesome guest speakers here, Dave, Nichole, and Kevin, who are going to share their personal stories and tips to help you feel more confident in managing your health. So to start off with Dave, when he learned that his kidneys were no longer working, he was caught off guard, but he did not let that stop him. He worked closely with his care team to take control of his treatment plan, and now he's passionate about helping others to do the same. Dave serves on multiple boards and committees, including the Kidney Transplant Collaborative and the FDA's Patient Engagement Advisory Committee. Nichole here is a total powerhouse when it comes to kidney disease advocacy. After experiencing both peritoneal and hemodialysis, she received her first transplant in 2008. She's a huge advocate for home dialysis and works on initiatives like the Kidney Precision Medicine Project. And Nichole's story is one of resilience, and she's here to share her experiences and insights with us today. Kevin here has over 25 years of experience in the pharmaceutical industry, but what really makes him stand out is his passion for patient advocacy. Kevin is a kidney transplant recipient and the founder of The Voice of the Patient, Inc., and his work focuses on advancing kidney disease treatments, and he's committed to helping others along their health journey. So let's just dive into the discussion and let's talk about doctor's appointments, which, let's face it, can sometimes feel a bit overwhelming. Can you share a conversation with your doctor that helped to improve your care?
Well, Bridget, the conversation that changed my trajectory as a person with kidney disease happened in the spring of 2010. Um, I was a I was the poster child for poor self-management as a dialysis patient. I missed many dialysis sessions, and I didn't like dialysis at all. But one of the reasons that I missed sessions was because I couldn't afford the cab fare to get back and forth to dialysis. It was $20 each way, and I wasn't working at the time. So that made it easy to not go to dialysis. And what also made it easy was, when I didn't go to dialysis, I didn't die. So I didn't think it was that big a deal. One of the reasons I was having these challenges was because I never had a conversation with my healthcare team when I started dialysis about the things that I might need to have a good experience as a dialysis patient. So I was struggling for my first 6 months until I had an in-person care plan meeting with the care team at the clinic. And I had an opportunity to, when they asked me why I was missing so many sessions, I was just honest. I told them I couldn't afford the cab fare all the time. And they didn't know that. And they also didn't know that I didn't know how to prepare healthy meals. So once they had that information, we put together a care plan pretty quickly that changed my life. And to show the difference that a person-centered conversation can make, I actually saved the documentation from those care plan meetings back in 2010. I have one here that was 3 pages, and it says I was non-compliant 7 times and other sorts of medical jargon that I signed, but I didn't read it because I couldn't understand it. And a week later, I had a care responsibilities following care plan meeting document, which is 62 words, including names and dates. And it's exactly the prescription I needed, which is calling Social Security, getting a food pantry service, and signing up for paratransit. And those are the interventions that I needed to have a chance at being a good dialysis patient. But at the end of the meeting, I was also told that I had to own my plan of care for it to work. And these are dots that I never connected, and it all made sense within a few hours. And that's kind of the reason I'm here speaking with everyone today. So I learned that I have to ask for help when I need it, and I have to know how to graciously receive it and be honest about what I need in my care.
Yeah, I think mine starts with when I was, I was being seen by a primary care doctor. This is, a long time ago, 25 years ago. And when I was seeing this doctor, he knew my family history of polycystic kidney disease. And he said that I was doing fine with my kidney function. And then about 4 months later, I asked him to do an ultrasound to determine I had polycystic kidney disease. I did. And so I went from the manner of him telling me I'm doing well to him telling me I'm now going to renal failure after I asked him to do this test. And then when he wanted to make a referral to a nephrologist, I said no. And so the reason I give that example is that I think all of us should just trust our instincts. Just because you don't have a MD behind your name or don't have a scientific background, trust those instincts. Because I was very fortunate. I ended up going to another doctor at an academic center, and I ended up having a preemptive transplant, which I was not aware of. So I was able to avoid dialysis. And there's other reasons behind that why many people aren't given an option. But I think my main message to this audience is trust yourself. If something doesn't seem right, don't deny those feelings. And it's proof. And I've got other situations I could describe, but bottom line, trust yourself.
Definitely important with self-advocacy to trust your gut.
Yeah.
How about you, Nichole? What's your experience?
Uh, sure. So, honestly, I crashed into dialysis in 2003. And from 2003 until about 2014, when I met these wonderful people on here, it was a blur because I didn't know that I needed to ask questions. I didn't even understand a lot of this that was going on. So I didn't know that I could advocate for myself. I didn't know what questions to ask or different things like that. But by the time I had to have a second kidney transplant, my transplant started failing around 2016. And I was aware by meeting Kevin that I didn't have to go on dialysis. I could, beat it. I could just go get a transplant before I was able to fight for that and also able to have those conversations. The main conversation that I had is I kept telling my doctor, my nephrologist at the time, I think my kidney is failing. And he was basing everything on the numbers and saying, no, it's at the regular point where it should be. And I said, no, I'm telling you, I know my body and I know that it is failing. And so we went back and forth with this for a couple of appointments. And then finally, after about 6 months, I said, I'm going to go to Texas, which at that time I was living in Iowa. I said, I'll go back to Texas to my original doctors. They will do a biopsy because I've been asking for a biopsy. He kept telling me, no, it wasn't necessary. I didn't need one. And so by the time I told him that, he said he would do one. He said, I'll do one just to appease you and show you that there's nothing wrong. However, the biopsy showed that my transplant was 90% scarred. So he was shocked and I was upset. But, we made it work. And I knew at that point I needed to fight to get on the transplant list again and different things like that. But it was just, having that conversation and believing in myself, believing that I can self diagnose myself. One of the things that my doctors now know is that the numbers never tell my true story. So I can't go based on what the numbers say. I have to go on what I feel and take it deeper than that. So, like Kevin said, trust your gut. Another thing is make sure that you're getting mental health because through this journey, if it wasn't for my therapist, I don't know how I would feel, where I would be. So that's another thing that I suggest.
Yeah,
That's a great.
and if I can amplify that about mental health, that is a huge issue. With kidney disease, don't run from it. There are solutions, but I had the same challenges that Nichole mentioned, but there are solutions.
That mental health is incredible to shout out, and also the support from others who understand what you're going through, that advice from Kevin, those make all the difference, the support, both in mental health and just your own community. Now, my next question here is about advocating for yourself in a healthcare setting, which you all have touched on. Kevin, you said you had multiple different scenarios in your health journey that you had to advocate for yourself. Was there one that comes to mind that you found especially frustrating or super impactful?
Yeah, there's certainly one. I was diagnosed with prostate cancer. This was back in 2013, um and so the biggest difficulty I had was getting some direction from my physicians. I wasn't really getting clear direction. And then I was seeing a oncologist, urologist. I think he was a combined specialist, and he looked at my Gleason score with my prostate cancer, and he says, I don't think that there's really any need to do anything other than watch and wait. And I said, again, this is where I go back, trust your instincts. I said, I'm not comfortable with that. I said, I'd like you to take my case to a tumor board and have them review it. I wanted to see little people with gray hair that were look at this. And this guy was great. This physician, he was terrific in terms of being very open to this. So I've got to compliment him. But when the tumor board looked at my case, they said, no, an intervention needs to be done, either surgery or radiation treatment, whatever. And so that created a whole nother set of circumstances. But if I had just sat back there again, like Nichole says, right? You know in your heart of hearts what's true. And I always say, if you could always tell a doctor, if you push back a little bit and they get defensive, then maybe you need to find another doctor. But like this doctor was very great. He was like, we were working together, could not say enough nice things about him. And that could have had a big impact on my life. So again, trust yourself.
Absolutely. I like that about the defensiveness, the pushback. It's such a
If you
reassuring
receive it.
feeling when you feel heard.
And just to be fair, I mean, clear, I've had great care. My doctors have all been very open to working together. Great care.
Well, I will just get to the most important time I advocated for myself, which was in 2015 when my dialysis clinic is affiliated with a academic hospital here in the Washington, D.C. area. And at the end of 2014, they opened up a transplant center. And their office was actually located in the same building as my dialysis clinic. So one day in 2015, I just went from the third floor, took the elevator up to the seventh floor, and I volunteered myself to be evaluated for a kidney transplant there. And I was already listed at two different well-known transplant centers in this, I believe it's called the catchment area for organ transplants. But I started the evaluation process at the new clinic in March of 2015. It took a few months to get all my tests done, but I was listed on July 26th of 2015, and I got my call for the kidney transplant from that clinic the very next day. I actually had a voicemail waiting for me when I got home from dialysis one Saturday. And so that shows the power of self-advocacy right there. I got myself a kidney transplant just by, taking the steps to get evaluated at a different clinic.
That's amazing. Nichole, how about you?
Yeah, so it seems like I've had to be an advocate for myself throughout because of, for being dismissed or not taken seriously. And I had to find my voice and make sure that my voice was loud, my voice was heard, my voice was understood. And so, as I stated, when my kidneys started failing, my transplanted kidney started failing, I was living in Des Moines, Iowa. And so, first off, I went and I was listed everywhere. My nephrologist at the time was saying, let me know where you want to go and I'll send the papers. I didn't wait on that. I started making phone calls across the country to try to be listed. And that's what I did. So I moved back to Dallas in 2018. And when I moved back to Dallas, a whole new center, entire, new group, and they told me I needed to be on dialysis immediately. And I said, no, I do not need to be on dialysis. I don't need to be. I've been fighting for this transplant since 2016. And I knew I was fine with just waiting and, waiting it out. I knew my body and I knew it was not time for a transplant. So what I did is I just kept holding out and saying no. And he would always tell me, "You're going to crash into dialysis. You're going to do this." And I said, "Yeah, I don't think so." And so I ended up with a very bad infection, a pneumonia that landed me in the hospital. Of course, my creatinine went very high to fives. And so they wanted me to start dialysis immediately with that. And I kept telling them, no, no, my creatinine will go back down once you guys clear up this infection. So we went back and forth with that. I was finally released 2019. And what I did at that point, because they kept telling me I had to go on dialysis, I needed to. So what I did was I found the nephrologist that they thought was the top nephrologist that they looked up to. And I went to that nephrologist and got a second opinion. And I asked him, could he write a letter and send it to them telling them I didn't need to start dialysis, which he did. But they were a little upset about that as well, because I guess I went over them. So in 2020, when COVID started, I said, I went to get the letter saying I couldn't go in office to work because of the pandemic. And the doctor said, you have to start. And I said, well, I am having a lot of swelling. I am having a lot of different things. So, yes, I probably do need to start. I said, I promise. Did we, I said, I promise that we will. I promise I'll start July 1st. July 1st, I will start dialysis. However, in April of 2020, the very next month, I received a call for a transplant in Iowa. So I was able to avoid going on dialysis.
But I would like to talk about, advocating for modality change, if you think that's what you
Mm.
of course, one aspect of that is getting evaluated for a kidney transplant. But not everyone may be able to do that, and that may not be the right choice for you at a particular point in time. For me, my first 2 years as a dialysis patient, I didn't want any part of a kidney transplant because all I saw in my dialysis clinic were people with failed transplants. So that's all I saw and all I heard were failed transplants and people just talking about what a bad experience they had. So I wanted no part of that, but I was very fortunate to have a very compassionate social worker who told me to always keep my mind open, right? Keep an open mind. So that's what I did. So eventually, when I, I had that change of heart about being, about managing my own care and started going to dialysis regularly, started feeling better about myself, um, taking some steps to make lifestyle changes to improve my own my chances. I did a couple of things at the end of 2011. I mean 2010. One was I stopped smoking cigarettes, and the other one was I started exercising again. And the people that know me have heard my exercise story too many times. But for those who haven't, on New Year's Day, 2011, I couldn't do a single push-up. And that moment changed my life. The very next day, when I woke up, I asked myself two questions. I said, are you physically able to exercise today? And do you have time to exercise today? And for a year and a half, every time I was asked myself those two questions, and I said yes, I got in a workout, no questions asked. Some days I wasn't physically, I just couldn't do it. And other days I had things to do like doctor's appointments. But when I could exercise and I had the time, I did. And as of today, I've done over 220,000 push-ups since that day. And one thing exercise did was it just I stopped missing dialysis sessions. I was just so regular when I would change my dialysis appointment so I could go to a meeting. And when I would come back on my regular schedule, they would all say how they miss me because I wasn't there, you know. So I'm saying all this because, we are patients all the time, but we're only in the healthcare system a small fraction of that time.
Ooh,
If there's anything that you can do on your own in terms of lifestyle changes or anything else you can do to, you know, change the course of your care, I strongly encourage you to take a look and see if there's anything, um, you know, that you can do yourself without having to ask anyone. Now, in terms of exercise, it's helpful to ask your nephrologist or your primary care if there's anything that you shouldn't do. Like, for example, I have a fistula on my upper arm. So I asked my access surgeon if there was any limitations to my exercise. But he gave me a green light and said no limitations. And that's all I needed to hear. I was gone.
yeah. I didn't have a therapist who was based on kidney disease. However, he cared about me, cared about my mental health. So he went and found out about kidney disease. He had someone in his church who was on dialysis. So he had a little bit of information from that standpoint. But he went and he got the information, and then we just kind of talked it through. As far as my mental health, one of the things that I want to say is being friends with you guys is I always say this, and I don't think people understand how important it is to have people in your life who who've gone through the same things that you've gone through, or who've been there, who know how you feel. Because I have friends that I've been friends with forever, but they will never understand how I feel like you guys do. So just being able to pick up the phone and call you Kevin, call you Dave, and say, hey, this is what's going on about anything, not even necessarily kidney disease, and you being able to give me that information is great. Because everyone, like I say, people can have sympathy for you, but it takes a special person to be able to empathize with you, and they have to have gone through what you've gone through. So as
Well said.
yeah, so as far as mental health, you guys, the kidney community, all the other people that I speak to, Curtis, Patrick, everybody else, Glenda out there, have really helped me tremendously. But as far as, going a little bit deeper, I did have a great therapist in Iowa. And I just found that, called my company's EAP and asked for a suggestion. And I just went with it from that way.
I would say, I'll just speak for myself in terms of, I think what is key is like what Dave was talking about is that I think if you establish discipline in your life, like Dave's talk about the setups and all that, for me, I'm really boring. My family makes fun of me. I do the elliptical and they just laugh at me and they say, you're so boring. But that gives me something that to do every day that I have control over. And then I feel better as a result. So I think when you say what struggles, I think I would say the biggest challenge for me speaking is that you face the unknown with a
Mhm.
chronic illness. And I think I kind of at some point came to a piece of just saying I'll do all I can, and then I just have got to let it go because you'll drive yourself crazy. Anyway, that's just. But I know the people on this call do everything they can too. But anyway, I'm just curious what others have to say. So
I think what I struggle with, one of the biggest things I struggle with is the fact that kidney disease is an invisible disease. So if I went around and they could see something wrong with me, if I was in a wheelchair or if I didn't have any hair, they would assume I would have cancer or something, and people would understand if I didn't feel good. However, because I have kidney disease and I'm transplanted, people seem to think that I'm cured and that there's nothing wrong with me. So they don't understand. Even in work, if I say, well, I'm too tired to walk to a certain, a certain length to go grab a bite with you guys, or I'm too tired to do this. And I mean, even family members, which is why it's great having a kidney community of friends, because people just don't understand. So I think that's what I struggle with a lot. And then also with me
Yeah.
being 21 years in here in this game, I do honestly struggle with uh, what's going to happen to me. When is it going to happen to
Yeah.
me?
Yeah.
Um,
Yeah.
I feel great now, and
Amen.
I will tell you, I am. I get scared, and I get scared even more so. I think when I see other people around me pass away and they
Yep.
don't even have any kind of kidney disease or any diseases. And I'm like, wow, what about me? I have all of these things. So I just try my best to keep positive, keep, have these open communications, open conversations, again, with people to try to keep me uplifted.
Yeah, same here. As I think a lot of transplant recipients, we kind of push to the back of our mind, like I'm about to celebrate my 10th anniversary of my kidney transplant from a deceased donor. 10 years out is a long way out, and I know that my transplanted kidney Hercules may have an expiration date that I don't know about. And, I can't worry about that all day, every day and live my life. So I just have to sort of put that aside and like Kevin said, do everything I can every day to uh optimize my health and be the best advocate for my health that I can be. And once I've done everything I can do, I just sort of have to put it out of my mind. And I do a lot of mindfulness exercises, like deep breathing
Yeah.
exercises to maintain a calm frame of mind every day, which can be very challenging to do, as you all know.
Just Dave listening to you though, but just knowing you as a friend and advocate, I mean, one of the things that I do know is that you have embraced a life of wellness.
Yes.
And I think that that's a choice, right, Nicole? That
Hmm.
that's a choice that, and I know you have, I have, it's not just taking the medications, but it's like Dave says, it's, the meditation, these other aspects that provide more of a balanced perspective to life. We all get out of it, believe me, I do. But I think that that's a really key point that I've seen with you over the years. And I think it's something I wish more people were embracing. Our doctors were encouraging our patients to learn from people like both of you and myself, because we've been able to be successful and we've had certain, well, I can speak for myself. I've had certain advantages, but we've also made certain decisions too, right? With discipline, positive, we make sure we're not around people who are going to bring us down.
Right.
Anyway,
Have type 2 diabetes, but which is really strange, I didn't develop type 2 until after I was transplanted. So I don't know how that worked out or what happened. I just really don't know. But it wasn't. I didn't. I wasn't type 2 until post transplant.
I'm borderline myself, and I think it's because of the post-transplant medications. I'm usually a shade. I'm basically pre-diabetic all the time, but I'm not diagnosed with type 2 diabetes. So I really have to watch my sugar intake, and there are things I do to do that. But I will share with you, um, every time I do blood work, I go right out and I celebrate.
Yeah.
You know, I'm like, okay, how am I gonna reward myself? And I do. I get a sweet snack, I get a bag of chips, and I enjoy it. And then I just go right back to my discipline.
I'm in the same cat. I love Dave. That's a great story. I am pre-diabetes like Dave since the day of transplant. It's been an ongoing struggle. I'll just say this though. The nice thing is, like, if you do have type 2 diabetes, there's now lots of approved treatments now for type 2 diabetes that can address it. I'm on an SGL2 inhibitor. I'm not giving medical advice, but I mean, there's things you can do to help manage that. And anyway, we're not here to provide medical advice, just what we've experienced. So anyway,
And y'all know how I am about sweets. Everyone knows how I am about sweets. So what I did was I just made sure I went to the dietitian. I said, hey, I'm gonna eat hot tamales. So I need to know how to incorporate hot tamales into this to make sure that my sugar levels are okay. So now I know when I need to eat hot tamales after a full meal and how many I can eat. So that's how I manage it.
Bridget, we've hijacked this conversation. Please
Yeah.
I love it.
say this.
That's why you're all the pros. Great conversation. I've been able to hear in, and I love the advice, Nichole, about like, this is what makes me happy. So
Yeah.
how can I incorporate it in a way that, it doesn't all have to be black and white. Sometimes we can find that gray and make exceptions.
Right. Mine wasn't anything formalized or anything of that nature. It was my personal healthcare plan on what I wanted to do. Even with the issue with them demanding pretty much that I go on dialysis and me saying no, I'm not going to go on dialysis. That was creating my own health plan. Sometimes I include them in on it. Sometimes I don't. Honestly, but because I feel like I have to be in control of my body. That's just a control issue that I have. I'm not going to do anything to harm it. I'm going to listen to them. I'm going to take their advice, but I also am going to let them know when I don't agree with it. And so, luckily, I've had, pretty good doctors sometimes who will listen to that and they will make that work. But that's the only thing I've done as far as planning.
I, I'll just say this is that, I'll speak for myself and Dave and Nichole, you can chime in, but I'm 20 years post-transplant and there's a lot of conditions that come up because of taking, chronic immunosuppression. So I've had to actually really kind of push this with my doctor. So I just recently had an appointment with my endocrinologist. I had an appointment with a cardiologist. I need to make an appointment for a colonoscopy. So, I mean, to be really honest about this, is that these are things that are not being brought up in my appointments that I've brought up. Another example, I mean, and this is not a criticism, it's just that these doctors are so busy with so many patients that if you can take that charge, it helps everyone. So that's the thing that I do is that, like when I go to an appointment, I realize that there's these different specialists I haven't seen, and then I'll ask them to arrange the appointments.
I,
But
I,
yeah,
I definitely support that. And that, you know, uh, it's sort of an ongoing thing. I don't, when I see my nephrologist or whatever doctor I'm seeing, I'm prepared with questions.
yeah,
It may either about medications or something that, I want to consider, in a lifestyle change. But what Kevin said, just said about these healthcare professionals being very busy, sometimes things fall through the cracks and it's no one's fault in particular.
exactly,
Everyone's doing their job. A perfect
exactly.
example is this morning, I spent half an hour with my health plan, um, getting one of my immunosuppressants taken care of. Um, for some reason, my prescription expired and my provider keeps refilling it, but when you refill an expired prescription, nothing happens. So I had to take the time to go into my record and find out that my prescription expired and connect all the dots. So my insurer can fax the information to my provider so I can get my immunosuppressants filled so I don't run out. These are the sort of the things that you get used to doing over the years. You know where you have to be the bridge to make those connections to make sure that you get the services that you need.
And I think, also making sure that you ask. If you don't know something, make sure you ask. I've heard in the past 5 years of two people, one person who lost his transplant because he didn't take the medicine didn't have the money, wasn't aware that he could just simply ask his social worker for help, and someone else who came close to losing his for the same reason. So, one of the things that I stress is just to make sure that you ask. If you don't know, don't ever be embarrassed to ask the question. I think, what do I have? What is this? What can I do? One of the
Yes.
things that I always ask, and this is in just life, what are the next steps? What are next steps? So that's what I would go with.
To optimize the length of my kidney. That's
Yeah.
always the question.
Hmm.
And I'm always trying to figure out, is there, are there just asking questions, right? What can I do? And like, Dave says, I've struggled with the sugar part too. That's part of trying to impose some discipline. Um, but I was just looking at some of the comments, if it's okay, Bridget. Someone in there
Yeah,
just
of
shared
course.
one of the, I love this, is that someone shared and they said that their last nephrologist wasn't listening to them about the aspect of sodium, and they fired their nephrologist. And all I could say
Good,
is
good,
applaud them.
good.
If you're not being listened to
Mhm.
and you're not being treated with respect, I mean, who would not take a look at two cars besides before you decide to buy it? I mean, if something is important in your health, if you're not being treated with respect, or you're not being most importantly listened to, find someone else. So kudos to whoever that person was.
Yeah, I think, one of the things that I, started doing after I took hold of everything is going and even interviewing. I make appointments and they'll say, oh, well, they'll bring you in for a first appointment. And I told them, like, no, I need to talk to see if I even want to use this person as as a physician, when I was moving back to Texas and having to establish all these different connections. Don't just assume, I don't want people to assume that just because I called or I got their information that they are going to be my doctor, because I take it, I always say, and Dave and Kevin have heard me say this, it's a privilege to be able to be my doctor in any capacity because I'm a great patient. So I have to make sure that they deserve to be able to be my physician.
Absolutely. I think
And
that's a mindset not everyone knows that they can have and should have. That
but
it's important that they feel that confidence in themselves in the healthcare space.
and the more that you take care, or you take control of what you can take control of, improving your
Mm.
knowledge and so forth, the healthcare team is going to treat you accordingly.
Yeah.
Yes.
So if you don't say much, you're not quote unquote a problem patient. Oh, that's fine. That doesn't. I hate to say that, but the more you know, the more you show that you are on top of your game, you'll be treated differently.
That's right.
And that's also true in a more positive way. I've learned, when more than once when I've asked one of my doctors a question to show that I'm interested, they'll say, "Oh, he's interested. Well, then
Right.
we'll show you. They'll go to great lengths to show you how much they know. And you learn a lot that way. I just remember once I pointed out, what was it? It was some reading, and that the doctor said, "Oh, you want to know about this?" And like 5 minutes later, I was like regretting that I asked because
Yep.
but it really shows, if you show that you're really interested, people will notice that. And they'll anticipate you asking questions, and they'll be prepared to answer them, and be more willing to help you as opposed to just sort of carry you along, if that makes sense.
I think that's the best way to put it, Dave. Make it in the positive framework, because I think for the doctors, then it's more enjoyable for them too, right?
Yeah,
Right.
It's
yeah,
much better
absolutely.
And I
experience.
think to understanding, I feel like I'm a very intelligent person, but there are some things I don't understand. When I had to go to that dietitian to talk about why my numbers were looking crazy, I was dropping really low at night, and she was telling me it was because I was eating so much and then it would just take a dive. But I had to tell her, because at first she was telling me all these things in these terms that most people understand, but I had to have her draw a picture. I said, I need you to draw a picture because I need to understand what's going on in my body when all of this is happening to make sure that I can avoid and work with my body. I have to see things written down to explain, well, this is how it's working and this is what's going on in your body when you're doing this. And so now I can visualize what's going on in my body when I do certain things, when I eat certain things.
Nichole brought up a great point that she likes to see things written down. I like to read too. I'm a proofreader, that's what I do for a living, but other people may like videos, it's important that your healthcare team knows how you like to receive information as opposed to them just giving you what they want. It shouldn't take that much on, their end to present information in a way that's more accessible to you.
I would just, I think like become a member of an organization like AAKP, National Kidney Foundation are good ways to start there. But I'll just speak for myself and then turn over to Dave and Nichole. But what's helped me the most is like, my wife, doesn't really understand a lot of what we go through. And so like Nichole said, I find most of my support is coming from my transplant community that we've formed our own. That's where I get my support. But you got to start somewhere, and you start with a patient organization. But I think I always try to find people who are going to elevate you
Yes.
and not bring you down.
Oh gosh, Kevin, I can't express that enough. We've been discussing that the past couple of weeks. Even Dave and I, talked about that a couple of weeks ago. Making sure that you have positive people in the community. So even when I think back to how I met you guys at events, kidney
Exactly.
events, and we connected, we bonded, and everyone who's in my circle, my kidney circle, it's all been because we met at an event or something like that, and we just clicked and kept in contact. And so this is years and years ago, and now it's y'all are family. It's just a big family.
And and I think it's a great point because like we were all involved with volunteer activities, so making
Yes.
it not just about ourselves,
Hmm.
but the broader community. Um, I think that's a great way to start. If you becoming involved, you learn. I'm not. I would say this. I would be really um, a little circumspect with Facebook groups. There's a lot of sometimes not exactly the most accurate information being communicated out there by some people. I'll just leave it at that.
I mean,
Yeah,
and even Responsum, you can,
Yeah,
meet people here. They may be able to start a group about people who
yeah,
want to meet up or something
Yes.
like that. That would be good.
yeah. That's a great idea.
We love that idea. And our community chat is always open, though I do know it's great to have the accessibility of online if there's no one nearby, but there is also value in meeting in person. So we have an article on how to find in-person support groups that I'll make sure we distribute along with the recording of this webinar.
Today, I was looking forward to today. It was a good chance to see both Dave and Nichole, right? See your friends who've been through that. And so I think it's just something that lifts your soul.
I
Yeah,
agree.
we've been colleagues for so long, and we're just so familiar, and that's a great reason why it's helpful to find that support and
Exactly.
and hold on to it because we're here for each other, and we stay here for each other.
Yeah.
If you want to anyone wants to be part of that group, we're easy to find on social media, each one of
We
us.
are. We are.
But I think that we are, but I think the part though is like I think you said a really good the like the Cole said is like, the orientation is that we wanted to go to these events because we wanted to help. We want to help others, right?
Yeah.
So I think that that's part of it. If you, because this, let's put this way, there's a real need for other advocates to become part of the community and just encourage people, challenge them to do this because, you know, my last 10 years doing this have been the happiest of my life
Yeah.
doing this.
That's, one of the things I said, Kevin, is I love you guys. y'all know how I feel about you, but I wish I didn't know you like this in this
Right.
capacity. Kidney
Right.
disease is one of those things that it's like, y'all they're great people, but oh, I wish I didn't have to know you. But you guys make this journey a lot smoother.
You know, when I became an advocate, it was for 100% selfish reasons. I'll
Mhm.
never forget when I saw in that waiting room that patient advisory committee pamphlet, and I saw what the ESRD networks do, and a light bulb just went off, and I said, I need to be part of this group to make sure that they know that I have pull here at the clinic. But
Mm.
I found out
Nothing
pretty
wrong with
quick.
that.
Yeah, yeah, yeah,
Nothing wrong with that.
yeah, yeah. I found out pretty quickly though, once I met and started to know the people in the patient advisory committee that it was more than just about us. It was about the entire community and making care better for everyone.
Well, thank you all for sharing so much wisdom and advice, and your stories will bring so much hope to others who are trying to own their own care plan. Before we go, you've shared so much, so it's okay if you pass, but are there any last words of wisdom you'd like to impart on those joining us today?
And the first I would say is do whatever you can to hold on to your kidneys. Whatever you can. I would just encourage people. This is an exciting time now for nephrology and for people with kidney disease because there's a much greater investment. So I encourage you to learn about clinical trials, to make sure you're receiving the best possible care on medications. There's medications out there that are proven to slow down progression of kidney disease. I'm very excited about where the future is. But the one thing I'll say to you too is that, if you are on dialysis, or if you're not in dialysis but headed towards kidney failure, tell your doctor what you want. If you want a kidney transplant, you tell them, I want a kidney transplant, and you tell me what I got to do to make it happen. But don't settle for low expectations. No room in this area for that. Been too long. So anyway, those are my thoughts.
I love it. Thank you, Kevin.
Just ditto what Kevin said, and like I always say, make sure you listen to your body, trust your instincts, and go with those.
And I would just add that learning to advocate for yourself is a process. Most of us have had to learn as we go. I mean, I'm certainly a lot better at it than I was, 10 or 15 years ago. But I've had help along the way. And so if you need help advocating for yourself, you can ask for that as well.
Mhm. That's
And,
true.
and if I can help anybody that's on this call today, feel free to contact myself. I'd be happy to speak with you. So
Same.
Thank you again all for joining, for all of your time and heart that you put into this chat. I'm so grateful to have you as a part of the Responsum for CKD community, and it's been a pleasure talking with you all.
thank you again for the
Thank you.
opportunity.
Thank you, Bridget.
Wonderful
Thanks.
conversation.
Yeah.
Thank you so much.
Mhm.
The highlight of my day. It will be.
Thanks all.
All right.
Bye now.
I guess.
Bye.
Bye.